Type 2 diabetes. Type 2 diabetes mellitus is a metabolic disorder that results in hyperglycemia, high blood glucose levels due to the body being ineffective at using the insulin it has produced. Also known as insulin resistance. Being unable to produce enough insulin. Type 2 diabetes is characterized by the body being unable to metabolize glucose. This leads to high levels of blood glucose, which over time may damage the organs of the body. From this, it can be understood that for someone with diabetes, something that is food for ordinary people can become a sort of metabolic poison. Type 2 diabetes is a serious medical condition that often requires the use of anti-diabetic medication, or insulin, to keep blood sugar levels under control. However, the development of type 2 diabetes and its side effects can be prevented if detected and treated at an early stage. In recent years, it has become apparent that many people with type 2 diabetes are able to reverse diabetes through methods including low-carb diets, very low-calorie diets, and exercise. For guidance on healthy eating to improve blood glucose levels and weight and to fight back against insulin resistance, join the low-carb program. Following pre-diabetes or metabolic disorder, type 2 diabetes can potentially be avoided through diet and exercise. Type 2 diabetes occurs when the hormone insulin is not used effectively by the cells in your body. Insulin is needed for cells to take in glucose from the bloodstream and convert it into energy. Ineffective use of insulin results in the body becoming resistant to insulin, also known as insulin resistance, which in turn causes blood sugar levels to rise. In advanced stages, type 2 diabetes may cause damage to insulin-producing cells in the pancreas, leading to insufficient insulin production for your body's needs. Symptoms: diabetes. 1. Excessive thirst. 2. Frequent urination. 3. Increased hunger. 4. Extreme tiredness. 5. Sudden loss of muscle mass. Some of these symptoms are the same for type 1 diabetes, but in type 2 diabetes they tend to develop more slowly over a period of months or years, making it harder sometimes for people to recognize them as signs of an underlying illness. In fact, many people have type 2 diabetes for a long period of time before being diagnosed with the disease. Type 2 diabetes is frequently diagnosed following the results of either a fasting plasma glucose test or an oral glucose tolerance test. The condition can also be detected through a general health check with your GP. The condition can be detected through diabetes screening or may be picked up as part of other health checks,